Hello, this is our rehabilitation program for a patient with Extensor, Carpi, Ulnaris, Subluxations. I'm Kelsey Taylor.
I'm Gabby Santiago.
And I'm Taylor Sega. Okay, so first we're going to start out with the anatomy. Basically, the extensor carpi ulnaris is a muscle that runs from the lateral epicondyle of the humerus to the base of the fifth metacarpal. It extends the wrist and it ulnar deviates. Our scenario that we were given by good old Priscilla was a male high school baseball player whose extensor carpi ulnaris subluxed. It occurred repeatedly during fall ball, but no AT was present to evaluate, and he now complains to us after this morning's practice. Like I said, he was a high school baseball player. He's from Camden County High School. He's a male, 17 years old. He complains of pain mostly on the ulnar side of the wrist, which is this side. And his mechanism is unknown because it just recurred. The activities that he's doing repeatedly have caused him to have this pain. Like I said, it started in fall ball, but it's now spring ball, and his pain is reported at a 7 out of 10. Our initial findings were that the edema was 26 on the injured side, and it was 16 on the uninjured side. There was no ecchymosis, and there was no deformation.
All right, so moving into our phase 1. Our goals for our phase 1 program include reducing edema by 2 centimeters, decreasing pain by 1 point on the 10-point scale, increasing range of motion, improving strength, and decreasing pain once we improve range of motion and strength. To reduce edema, we will ice 4 times a day for 20 minutes and elevate, and also do effleurage massage 2 times a day for 5 minutes. To decrease pain, we'll use NSAIDs along with the ice 4 times a day for 20 minutes and grade 1 joint mobilization. We have range of motion exercises to improve range of motion, which we will go over here in a little bit. To improve strength, we'll use exercises that include ulnar deviation, wrist extension, radial deviation, wrist flexion, wrist supination, and wrist pronation. And then to decrease pain, the range of motion exercises will help with that, and we'll continue to ice and massage. All right. We'll also start the patient on a cardio program to help keep them in shape, to help them return to play faster. The patient will warm up on a stationary bike for 15 minutes at 60 RPMs. All right. The home stretching program includes exercises, wrist flexion, wrist extension, arm deviation, and radial deviation that we will demonstrate now.
Okay, so Gabby's going to demonstrate wrist flexion. So we want the patient to do 2 sets of 30 seconds. So you can pretty much do it yourself. Yeah. So wrist flexion is like this. You hold that for 30 seconds, and then you're going to rest, and then you're going to do it another 30 seconds. That's going to be wrist flexion. Wrist extension is the other way. Doesn't matter. Also 2 sets of 30 seconds. Ulnar deviation, and then radial deviation. Hold on. There you go.
Ulnar deviation and radial deviation.
Yeah. So you want to hold those for 2 sets of 30 seconds, which is going to allow the muscle to have a more effective stretch for a long period of time.
All right, our home exercise program consists of the same exercises: wrist flexion, extension, ulnar and radial deviation, and these will help to improve the strength and the range of motion.
For, okay, we don't have a TheraBand, so don't yell at us, but for wrist flexion, we're going to do that same thing, except we would have a TheraBand attached to something, and they basically would do this, and wrist extension, it would be the opposite way, and then ulnar and radial deviation. Well, like I said, we don't have a TheraBand. So phase 2 goals are going to be reduce edema by an additional 4 centimeters. We want that to be done by day 20. We're going to continue to elevate ice 4 times for 20 minutes a day. We're going to decrease pain an additional 3 points by day 20, and we're going to continue to ice for four times for 20 minutes for that as well. We want to improve strength to 4 out of 5 for ulnar deviation and wrist deviation, and we want to improve strength to a 5 out of 5 for radial deviation, wrist flexion, wrist supination, and wrist pronation. We want to increase range of motion to within normal limits. We'll go ahead and read some numbers for you. Our within normal limits for ulnar deviation should be somewhere between 20 and 25 degrees. Radial deviation is 10 to 15 degrees. Wrist extension is 55 to 65 degrees. Wrist flexion is 70 to 80. Wrist supination is 75 to 85, and wrist pronation is 80 to 90. We're going to continue cardio on a stationary bike for 15 minutes. However, we are going to increase the RPMs, trying to get his heart rate up a little more. So we're going to keep that at 70. Okay, so this is ulnar deviation. Basically, what we're going to have the patient do is sit down in a chair in a comfortable position. We're going to tie the TheraBand around the front of their foot, and they're going to hold it in their hand, and they will perform ulnar deviation. So they're going to take their wrist like this and just go like this. So we're going to do that for 3 times 15, so 3 sets of 15. Radial deviation is in the same position, so we're going to have them sit in a chair, TheraBand around their foot, TheraBand in their hand, and it's a radial deviation, so they're just going to be going back this way. Wrist flexion and extension, that is going to be done with a 5-pound weight. So they're going to sit pretty much in a chair anywhere like that. They're going to rest their arm on a table or some kind of stable place with their wrist hanging off, and they're going to perform wrist flexion and wrist extension, just doing this with the 5-pound weight. Pronation and supination, it's done the same way with their wrist hanging off the side of a table or something like that. Then they're going to have a 5-pound weight for that as well. And they're just going to do this basically, back and forth. So this is pronation. Okay, to continue on with our phase 2, we're going to keep the home stretch program and the home exercise program that we showed you guys earlier. However, we are going to increase the home stretch program from using a blue TheraBand to a black TheraBand. It's a little more resistance to help with the exercise program. We're also going to increase from 2 pounds to 5 pounds for the home exercise program.
All right, moving on to our phase 3. Our short-term goals include increasing flexibility, which we will do with wrist flexion, wrist extension, radial and ulnar deviation. We'll do each of those 3 sets for 30 seconds.
Sorry.
We will also include a strengthening and endurance program, which will include a weighted ball throw, 3 sets of 15 with a 5-pound ball, a push-ups, 3 sets of 15 using the patient's own body weight, tricep dips, 3 sets of 10, again, just the patient's weight, supination and pronation, 3 sets of 15 using a 7-pound dumbbell, and a hand web, which is like a mesh thing that you squeeze, and we'll do 3 sets of 10.
So basically, for the weighted ball throws, the patient is gonna stand with is it medicine ball? Oh. Holding
If 5-pound medicine ball, sir. It's cool, go for it.
a 5-pound medicine ball, and they're gonna how did you explain it?
I got it, ready? Okay, so this is what's going to happen. So the patient is going to be standing. So the wall is right here, and the patient is facing parallel to the wall. What they're going to do is they're going to hold the weighted ball in their hands, whichever side is the injured side. So for our patient, it's the left. So we're going to act like the wall's over here. You want that to be away from the wall. So you're going to take the ball, and you want them to come back, rotation, in the hips and everything like that. You want them to come back and basically extend their wrist with the ball on it. So you want them to extend their wrist, and then you want them to come through and throw it with their injured hand following through. So you want them to come through and throw, and that creates wrist flexion. For the push-ups and tricep dips, those are pretty obvious, so I'm not going to explain them. Supination and pronation is the same as what we showed you guys before, which is just back and forth like that. And then the hand web looks like a big waffle. And you stick your fingers in it. It's got holes everywhere, and you stick your fingers in it, and you basically squeeze and extend, and the holes only let your fingers go so far. And there also is different kinds of hand webs, or colors of hand webs, so that determines like the resistance and stuff like that. For this, though, we're going to use red, which is like a medium level.
All right, at this point in our rehab program, we're also going to implement plyometric exercises. We'll implement cone zigzag. We'll do 2 sets of 15 seconds. A ball toss with a medicine ball, 2 sets of 15 seconds, and a depth push-up, 2 sets of 15 seconds.
The cone zigzag, basically, the cones are 10 feet apart in a zigzag form. Basically, we just need the patient to run to a cone, run to the next one, zigzag back and forth. Ball toss with the medicine ball is a lot like what we showed you with the weighted ball toss. Excuse me. However, we're going to have the patient catch him above his head and then throw it back. And then depth push-ups, they're a little complicated to explain, and I am not coordinated enough to do it right now. But you want the patient to be on a box and do a push-up, so like a plyometric box, so the hand will be on the box. Their feet will be behind them, balancing them on the ground. They're going to do a push-up, and then whenever they come down, they're going to hop down. So you want the box to be less than 6 inches, basically. So they're going to do a push-up, and then they're going to hop down, and they have to catch themselves. That's like stability, balance, stuff like that. They have to be able to have muscle control with the depth push-up.
So for our long-term goals for return to play, we want the patient to gain full range of motion, and we want to improve strengths to 5 out of 5. And we're by this time the edema should have already been reduced, and we're just gonna keep continuing to strengthen the tissues with progressive exercises. And we expect to be completed within 35 days of time of injury. So again, we're going to continue with the cardio for the patient. So they'll continue to be on a stationary bike, doing 15 minutes at 80 RPMs just to increase their intensity. Functional testing, we're going to have 3 exercises for functional testing. We're going to have just normal push-ups, and they're going to do 2 sets of 10 push-ups. If the patient cannot perform 10 push-ups without stopping or without pain, the test is failed. As well as our second exercise is ball tosses on a Bosu ball, and this is to assess patient's balance and depth perception. They'll stand on the Bosu ball and throw a ball back and forth. They can only drop the ball once per set, and the throws must be accurate. So they want to aim at the receiver's chest. So if they're like not throwing at the receiver's chest, they would be failing the functional testing. And they'll do 2 sets of 10s of the ball tosses, and then we're also going to do chest passes with the medicine ball, and this tests hand-eye coordination as well as strength through full range of motion. The patient is going to be 12 feet away from the partner, and they can only drop the ball once per each set, and then they're going to do 2 sets of 10 as well. Our sport-specific drills, they're going to do just some throwing the baseball with a partner, where we're going to have 3 different distances. They're going to be at 10 feet, and then they're going to be at 20 feet, and then they're going to be at 30 feet, and there's going to be 10 throws from each distance. Our second sport-specific drill is ground balls. So they're going to be fielding ground balls in between 10 cones. So at each cone, there's going to be a ground ball thrown to them, and they're going to have to bend down and pick it up and throw it back. So they have to throw it back at each cone. And then our last one is the agility ladder. The player is going to run from one end to the other, and they're going to be running, they're going to be catching, and then they're going to be throwing back the ball that is thrown to them. They're going to do 3 sets of 5 of those. So in summary, as stated before, the ultimate goal of the rehab program is to return the athlete back to full participation. By completing the short-term and long-term goals of this program, the athlete is expected to make a full recovery. At week 5 of the rehabilitation program, if the patient can successfully complete all the functional testing and sport-specific activities of this program and is cleared by a patient, he can return to his normal baseball participation.
All right, Priscilla. All right, so this is what we're gonna do because we like you so much. We're all gonna say something, kind of just a goodbye, wish you best of luck, kind of thing. I'll start off because I'm the best. Basically, what I want to say is I want to thank you for everything you've done. I know you kind of been thrown into a situation, especially with like gym ed and stuff like that. That's a hard subject to teach anyway. Therapeutic modalities. That's a terrible subject to learn. But you did your best with it, and you're always there to help us whenever we needed help. Your open ideas and stuff like that. We really appreciate the test corrections because that's the only reason I'm still in this program right now. Let's be honest. I also wanted to say, wish you the best of luck with everything you do in life. You're gonna be great wherever you go, and I hope that they appreciate you a little more than what you've gotten here. But just know that I appreciate you, and I'm making them, whether they like it. No, I'm just kidding. And then they appreciate you too. But go ahead.
All right. Thanks, Priscilla, for everything. You've definitely been my favorite professor in the program, and you've always been there. I feel like I can go to you and talk to you about anything, which is awesome because I feel like you can't go to anyone else. You've done a great job teaching with rehab and modalities, so I definitely retain a lot more from your classes than I do any other class. So thanks for everything you do, and like Taylor said, hopefully you'll get more respect and be appreciated more anywhere else you go. Wish you the best of luck.
Yeah. Just thank you for everything that you did for us. Thank you for caring about the success of your students. That really does mean a lot. There hasn't been a professor in the program that has really reached out to us the way that you have and given us as many opportunities as you have, and we're truly grateful to what you did. I know it was a hard year, but you stuck through it and you stuck with us, and we appreciate it. I wish you the absolute best of luck wherever it is that you go, and just thank you again. Thank you for also just being somebody that's very personable and somebody that we can always go to and just talk to, because I mean, I think all of us have had just like a personal conversation with you, and you were always there to just listen and relate to us. So that's really cool and really respectful of a professor. So don't ever lose that trait, because we definitely appreciate it a lot. And I hope that your next colleagues and your future students appreciate you as much as we did.
Sure. You're the bomb, Priscilla.